Hey everyone, Chris Kiefer here with Sky Media. A question that we get a lot is when you are posting on social media as a medical practice, a lot of times the most successful and highest engagement that you get on a post are posts that involve or somehow feature patients. And that makes sense on social media because it's a social platform. Someone sees themselves, it shows up on their timeline, they're sharing it with their friends. And so it's very important for a lot of practices to post about and to feature patients in their posts. But the question comes down to, what are you allowed to reveal or post when it comes to patients and your medical practice? All this stems back to the HIPAA Act, and HIPAA states that there are two types of information. There is PII and PHI when it comes to patient information. PII stands for personally identifiable information, and PHI stands for protected health information. Now, when you understand those two, there's a distinction between what is legal and not legal to post. PII would be anything that is patient's full name, so first and last name, their email address, their phone number. PHI is information on a particular, like the patient's blood pressure or notes that were taken from their health records. You are allowed in some cases to talk about the particular procedure that someone underwent. For example, if someone got new veneers, you would be allowed to mention that they have a fantastic new smile from your practice. That could fall into PII. However, what then happens once you distinguish between the information that is PII and PHI, you do need to get consent in order to post PII information online. PHI information, even with the patient's consent, you could be legally responsible and get into legal trouble because of that. So the safest thing to do is never ever reveal PHI information. PII information you are allowed to disclose or publish online with the consent of the patient. If you guys have questions regarding that in particular, those topics, PII, PHI, HIPAA, social media, best practices, please let us know. If there's some interest and buzz around this topic, I will be sure to create more and do some more investigation and research for all of you. Hopefully that's helpful. Thank you very much. Have a great night.